Let me just meet and greet. Assalamualaikum to everyone. How are you all? You can unmute yourself before we start. Great, great. Anyone else? Okay. Okay, now it's time. You may start.
All right, thank you, Sammy. Would you like to introduce yourself and speak a little bit about Project Management Olympus?
Yeah, sure. I will just introduce myself and my organization. Hello everyone, it's me Sami Ahmed, owner of Project Management Olympus. I'm Google certified in project management. This initiative was started in 2023. We didn't have any proper operations before 2025 June, and within that time we realized project management awareness is out of the growing trends. Right now, Project Management Institute, the industry leader for project management, has indicated by 2027, 88 million project managers will be needed all around the world. So, I had this vision, why not be a part of supporting the global economy? So, for that, I have started this webinar series. That over to you, Shawna.
Thank you, Sammy. Hi, everyone. My name is Shawna Calhoun. I'm so honored and thankful to be here with you all to contribute to these very important discussions in the project management community and to speak to Sammy, what he just said, to just help the global economy and just help our fellow humans out there. Before we dive in, I want to first thank Sammy and the entire Project Management Olympus team for the invitation and for building this community. It's a privilege, it truly is, to be a part of it. Again, my name is Shawna Calhoun, and I describe myself as a practitioner-scholar. On the practice side, I'm a project management professional. I have my PMP credential with PMI. I have over 2 decades of experience leading and supporting complex multi-stakeholder initiatives in highly regulated healthcare and complex healthcare IT environments. On the scholar side, I'm currently pursuing my doctorate degree in project management. What pulled me toward this particular topic, first of all, Sammy requested me to speak on this topic, but I see it as a connection between project management and sustainability, because sustainable outcomes aren't limited to the environment. They include improving health accessibility and how we will use scarce resources. Reducing patient wait times is exactly that kind of win, and it maps directly to the United Nations Sustainable Development Goal 3, which is good health and well-being. I'm presenting to you today from Texas in the United States, though I will admit my heart is already in Ireland, where I'm headed for the next chapter of my academic journey. I'll be pursuing a PhD out there, so I'm super excited. So let's talk about how our profession can make healthcare measurably better. Let's get into it. So first of all, picture this: a patient waiting 6 hours in an outpatient department. This is not an abstraction. Manzuela et al. In their 2024 study found exactly that baseline in a Tanzanian referral hospital. So today's webinar, we're going to cover barriers that make lean fade, the success factors that make it stick, the hard numbers from real hospitals, and where AI is taking this next. So I'm going to do my best to keep my presentation to about 45 minutes so that at the last 15 minutes, we can do a question and answer session. So as I am presenting, please hold your questions to the end. Go ahead and put your questions in the chat, but we're going to go back to those questions at the end. And I also have a few live Mentimeter polls throughout. Speaking of which, here's our first one. What I'm hoping to find out is, where are you right now? Who's in the room and what country are you coming from? So if you would use your smartphone, take a picture of the QR code, access the link, access the Mentimeter, and then just point to where you are located and put a pin where you are located. So you just put your finger on where you are on the map and click the submit button, and it will show a little pin where you are. There we go. And Sammy, I'm not able to see the chat. Let me know if anybody's having any issues. I only see 2 pins so far.
Now we can't see anyone else who has reported any issue or any concern in the chat.
It could be that everybody's just located in the exact same spot, which is a little surprising. So it looks like we've got United States, and apologies for the size of the screen. All right, well, this one may not have worked as well as I had hoped. So if you can, go ahead and put where you're from in the chat, and we'll just speak to that. All right. So first, we need to zoom out before zooming in. SDG 3, again, the Sustainable Development Goal 3, is the United Nations global goal to ensure healthy lives and promote well-being for all at all ages. It is one of the 17 SDGs established in 2015 to guide global sustainable development and achieve a set of goals by 2030. That's the goal. Lean management is a proven perfect fit to help achieve some of these goals. To be clear, lean is not about squeezing staff as some people perceive it as such. In this case, especially, it's about removing waste so that patients can get faster access and better care. The bottom line, shorter waits equal better access, less waste, and stronger sustainable systems. So we ask the question, why doesn't this just happen everywhere? So let's start why lean so often fails to stick. Today's webinar is structured in segments. So beginning with this segment, which is the framing, Today's structured presentation will begin in the next segment, barriers, why lean fades. Then we're going to talk about success factors, what makes it stick, proven results. I have the receipts. You want the receipts? I will share the receipts. And the road ahead, including AI. We're not going to get away with it. We need to embrace it and utilize it to its fullest potential to help, again, our fellow humans. Then a Q&A. And let me just go ahead and roll with the next Mentimeter poll. And hopefully this one works better than the last. All right. I would like to know where you are on your lean journey. Are you leading lean initiatives? Are you supporting them? Are you just learning about lean management, or are you brand new? This could be the first time you're hearing about it. And make sure after you make your selection that you hit the submit button. So again, use your camera on your smartphone to access the QR code, click the link, click your choice, and then make sure to hit the submit button. So the question, I think I just saw a question pop up to repeat the request. Just let us know where you are on your lean journey when it comes to lean project management, or what's also called Six Sigma project management. Are you leading lean initiatives? Are you supporting them? Are you learning about lean management, or are you brand new to this topic?
Shawna, I am finding the QR codes as unhelpful. Can you just share the link so we can fill out the forms easily, if possible?
I don't have the links readily available. We'll just go ahead and keep moving on. Go ahead and put in the chat what your choice is if the QR code is not working for you. Are you leading, supporting, learning, or brand new? All right, we'll just keep moving on. All right, the most common pattern is the fade when it comes to lean projects that are implemented. So first of all, on the left-hand side, we have the common story. First, we launch a lean initiative. There's a lot of energy around it. We have training around lean top concepts and tools, resources, and a lot of early wins many times, things to celebrate. We peak, we see our metrics improve, and momentum builds. But then eventually, when focus goes on to the next thing or other things, other priorities, attention shifts and gains erode. And we don't keep that momentum going, unfortunately. That is the common story. That is the common pattern. So on the right side, we see a little bit of evidence, especially around the Akmal et al. Study in 2020. It was a bibliometric analysis of 299 articles, which showed that tool-focused piecemeal adoption of lean initiatives actually undermined the intended system-wide effect. Again, most failures here are sustainment failures, not actually tool failures. And here we have 4 themes that came from the Kunin et al. Study in 2023. This was a Prisma-guided qualitative review of 24 studies that identified 21 facilitators and 17 barriers. 3 of the 4 themes that you see here: mobilizing employees, guiding change efforts, and local context. Those 3 are fundamentally about people and change. Only the methods category is about the mechanics. That's why tool training alone never fixes the fade. So I want to speak about the 17 barriers just to give you more of a description of these 4 category areas before we move to the next poll. And I'm really hoping the next poll works out well. If it doesn't, we'll just do our best. So mobilizing employees mostly has to do with when you have staff overloaded. And then we've got experts that dominate. So we bring in perhaps a third-party vendor who has experts in implementing lean initiatives, but then they dominate, and then staff actually gets sidelined. That means top-down, no staff input. And leaders undervalue their staff. So it's very important to address this category if that is your top pain point, if you will, in implementing lean initiatives, at least getting them to stick. Then we've got the guiding change efforts. These have to do with when you have no resources for staff. We've got weak leadership commitment. You can't see the big picture because there's just communication gaps. Any wins that are achieved are not shared. Again, it really leads to communication gaps. And no resources are provided from management. Then you've got, and I'm going to skip methods for right now. I'm going to move to the local context. The local context really essentially means not enough resources overall due to having silos, a top-down hierarchy, and just overall very lean resources, if you will. Then we've got our methods category. This has to do when the tools look easier than they are. Too much added to the workload for the staff. So you're not prioritizing well. And no follow through. Sometimes we don't have any follow through after the projects end. And then patients are left out. That's another aspect. Sometimes we don't hear the voice of the staff. Many, many times we don't get the voice of the patients, which is critical to really understanding where you should be prioritizing this. Then we've got our fixing the pieces, not the system. Here in the US, sometimes we call that Band-Aids. And then you have entrenched roles that resist change. So change resistance, I think that's pretty much a global thing. You're going to have people that resist change because perhaps they don't understand it, and that could be perceived as a threat. Then we've got our generic non-healthcare training. All right, with that said, let's try one more time. I think this is the last poll that I have. Let's see if that QR code is going to work. With your smartphone, try using that QR code and then click the category in your setting that you think is the biggest barrier for your project teams to overcome with implementing a lean initiative. And if this is working, we should be seeing a lot of dots being added to the screen here. So far we have one. I'll give it a few seconds, and if it doesn't work, it doesn't work. There we go, there's another one. Okay, good. Looks like this one's working. That's awesome. Very good. Well, all right, good. So this is good to know. I think you're gonna find some information on the following slides that will be very helpful to addressing these areas that are barriers for implementing lean in your setting. All right, so here's the facts. Lessons from Toyota, which by the way is where lean management comes from. Lessons from Toyota don't transfer cleanly when we're talking about hospitals that are structurally hostile to lean in 4 different ways. And this is based on the Van Zyl et al. Study in 2024. So we find that units in hospitals operate as separate profit and loss silos. They have hierarchies that are steep, which suppress bottom-up ideas. Many key players like physicians aren't even employees, so you can't mandate their buy-in, and staff are appropriately risk averse because we're talking about lives that are at stake. which makes the trial and error of normal lean feel unsafe, and justifiably so. So if structure and people are the barriers, then the success factors must be about people leadership and a safe way to experiment, right? Well, that's exactly what the evidence shows. So this is a common strategic mistake. Teams optimize the metrics leadership watches. That has to do with efficiency, cost, and throughput, while unfortunately neglecting what the patient actually values. You get a more efficient process and a patient who still waits confused. So here, the LEAT and Quadro study in 2025 frames this as value creation versus value destruction. And the Kunin et al. Study in 2023 flagged the lack of patient engagement as a recurring barrier. The fix is to define value with patients and align improvement to their journey. Do that and do it consistently, and efficiency and satisfaction rise together, as the cases in segment 4 will prove once we get there. So if those are the traps, what does the evidence show actually works? This is your evidence, not an opinion slide. The Sohal et al. Study in 2022 studied 62 completed Lean Six Sigma projects at a large public hospital and identified 8 critical success factors, and crucially, validated that all 8 are significantly correlated with project success. So think of these 8 success factors as 3 groups. First, we've got the people factors, which have to do with leadership commitment, staff engagement, communication, and culture and readiness. Then you have your discipline factors. You have your clear KPI-based goals, data and measurement, and training. And then, of course, you have your North Star, which is patient experience focus. In our next slides, we will show these factors in action. All right, so this is the heart of the whole talk. Across every strong case, the differentiator is ownership. When staff help design the change, they sustain it. Hamouda et al. In their 2021 study involved a pharmacy staff at every stage in a Jordanian cancer center. The team explicitly said that staff felt they owned the process, and that's why the results held. The Prado et al. Study in 2020 used a participative 3-pillar method in a Spanish sleep unit and cut urgent patient wait time by 71.6%. So engagement is not a soft nicety. Across this literature, it's the single best predictor of whether improvements will last. If you take one thing from today, take this. So leadership is what converts a one-off project into lasting change. The Naidu and Mohammed 2016 study, this is a clean example. The rural South African hospital succeeded largely because the medical manager personally acted as a champion and a facilitator. This was a named person who owned it. Then we have the SOLAR, Sustaining of Lean Adoption in Hospitals Roadmap, from the Van Zyl study again in 2024. They produced a roadmap that bakes change management theory into lean across 4 phases: prepare, plan, experiment and learn, and sustain. Importantly, leadership and culture are not afterthoughts. They're built-in phases. And the key point here, name a champion or expect the drift leading to fade. So let's first demystify the toolkit so newcomers can feel it's within reach. These listed tools are only a few of a plethora of lean management tools that recur across the winning cases in my research literature study. And here, Hamuda et al. 2021 and Naidu and Mohammed 2016. So the A3, wrong scroll bar. The A3 is a one-page problem-solving template. Then you've got your value stream mapping, spaghetti diagrams for physical motion. You have your Kaizen events, the 5 why root cause analysis, and DMAIC cycle. And my personal favorite is the swim lane process flow diagram. These are all very simple, they're learnable, and they are low cost. And again, the barrier is rarely the tool. It's the people and sustainment work we've been discussing. But I wanted to say I use the swim lane process flow as a tool on every project that I lead. And as stated in one of the research studies in my references list, the Erdman et al. 2024 study, that's exactly the tool that made the difference in a study at a US hospital. A team mapped their patient flow using swim lanes, and it revealed something no single department had been able to see on its own. The biggest driver of patient delay was what they call digital blindness, where staff simply couldn't see the information they needed to act. That one issue accounted for 61% of the delays. It's a perfect example of why I reach for this particular tool every time. The swim lane doesn't just document the process, it exposes the waste hiding in the handoffs between departments. And I encourage you, I'm self-taught. I learned this stuff on my own in various different ways. But one of my favorite personal ways is YouTube videos, as well as there's a lot of really good LinkedIn trainings as well, LinkedIn webinars. And also, again, PMI, if you're not already a Project Management Institute member and you're a project manager, I highly recommend. They actually have a lot of really good webinars as well. Moving on. All right, now the receipts. Concrete numbers. Hamuda et al. In 2021, their study showed an outpatient pharmacy of a Jordanian cancer center. Waiting times cut from 22.3 to 8.1 minutes. Of course, patient satisfaction went up from 62% to 69%, and staff satisfaction went up as well. The how really does matter on this one. They used the A3 problem solving and value stream mapping and discovered that the billing step was the major non-value adding bottleneck. So they moved it. That's a transferable insight. Map the flow, find the step that adds no patient value, and attack it. The Jordan case is a great example of a dual win. Patients and staff both gained. That only happens when lean is done with people, not to them, which ties straight back to the ownership slide we talked about previously. Then we have a financial case. The Al-Zain et al. In 2019, their study of a Kuwaiti private hospital OBGYN clinic ran a full DMAIC cycle with Ishikawa and Pareto root cause analysis and arena simulation. The results? They saw waiting time reductions of 46 to 67%, Six Sigma level gains up to 300%, and a projected $5.8 million in savings by 2025. Six Sigma is a reliability score, how often the process gets it right. The clinic started out failing most patients on wait times, and after the changes, it was getting it right far more often, cutting waits by roughly half. The caveat here, to my knowledge, there is no data published yet to show if they actually met their 2025 projected savings, but it's still a really good case to reference. Now I'm going to preempt the objection that this only works in systems where budgets are no issue. We have here two low resource cases that prove otherwise. Naidu and Mohammed in 2016 in their rural South Africa case, outpatient efficiency rose from 16.4% to 20.1% using simple Kaizen events. Manzwila et al. In 2024, their Kilimanjaro Christian Medical Center in Tanzania study, a 45% cut in waiting time from 6 hours to 3.5, with electronic medical records emerging as the single strongest predictor of reduced wait. Note on the rural South Africa case, efficiency here is the process metric, essentially the proportion of a patient's total time in the outpatient department, OPD, that was spent in a value-adding service being processed at a service node rather than waiting in queues. Two final proofs. First, we have Cam et al. From their 2021 study in Australia, a 9% increase in patients seen per session using purely low or no-cost solutions, schedule amendments, documentation templates. Capacity gains without capital expenditure. Then we zoom out to the aggregate so nobody thinks that these were cherry-picked anecdotes. In the Wyman et al. 2023 study, they found 5.2% to 97% wait time reductions across 9 studies. And Wang et al. In their 2025 study, they synthesized 60 studies confirming consistent gains across efficiency, quality, cost, and satisfaction. These individual cases are not flukes. The body of evidence is broad and consistent. Now let's pivot from receipts that prove that it works to here's how you can start. So remember the SOLAR model, SOLAR, Sustaining of Lean Adoption in Hospitals Roadmap. Again, that's from the Van Zyl-Silly et al. Study in 2024. This is a prescriptive maturity roadmap with 4 phases. We have prepare, read your context, identify stakeholders and patient value. You have your plan, set the adoption plan and success criteria. Then you have experiment and learn, pilot and adapt to your specific hospital. This is, by the way, the longest phase. And then you have your sustain, institutionalize, and keep measuring. This is the direct anecdote to fade. You want to get rid of the fade and maintain, sustain all of the wins, and in fact, continuously improve. Sustainment is designed in from day one. If you use this model, it's not bolted on at the end. This slide should be particularly valuable to the people who answered that they are leading or supporting these initiatives. And then for the road ahead, let's talk a bit about benchmarking for a bit. Benchmarking is an underused lever, and modern simulation makes it powerful. Benchmark both internally, units against each other, and externally against best-in-class organizations. That's from the Prado et al. Study from 2020, as well as the LEAT and Quadro study in 2025. The new capability, simulation, lets you benchmark future states quantitatively. The Franco Alucano et al. Study in 2025 ran 75 simulation scenarios across different staffing levels and patient arrival rates to find the optimal configuration before changing anything physical. This was a risk-free experimentation which directly answers the hospital risk aversion barrier from our slide 6 before. Now, this is what I call the frontier. Remember that EMR, electronic medical records, was the single strongest wait time predictor in the Manzwila et al. Study in 2024. And then Franco Alucano et al. 2025 provide us with a proof of concept. They integrated lean, discrete event simulation, and deep learning computer vision with a resource-constrained public clinical lab. The same DMAIC and value stream mapping tools that we covered, now augmented. So the results were powerful. Registration time went down 25%. Pre-sampling wait time down 20%. Turnaround time from 34.4 to 26.6 minutes. That's a statistically significant figure, and the AI matched human inspection accuracy. 2 points I want to stress here. Number one, AI complements rather than replaces staff. And number two, it worked in a low resource public setting. However, I do want to make an honest caveat here. As the authors themselves note, this is a single case study in one public laboratory, so the results aren't yet generalizable. Cost and staff patient satisfaction effects were not measured here, and AI deployment raises data privacy and ethics considerations that we still need to work out. But work through these we must. Now let's make this actionable. We have 3 steps. Number 1, name a champion with leadership backing. Number 2, pick one high pain process and map it with VSM or a spaghetti diagram, or in my case, a lot of times I use a swim lane. Number 3, define value with front staff and patients from day one. Make it about culture first. The Franco Alucano et al. 2025 study found that AI pays off most in organizations that already have an improvement culture. So you earn your way to the AI frontier by mastering lean fundamentals first. Start small, prove it, sustain it, then augment it. The very spirit of continuous improvements. If it goes quiet, let's see how we're doing. If there's no questions, I have some leading questions on your screen here. But let me see if there's any questions first. So let me see if I can access the chat here. Sammy?
Okay, everyone, you can ask your questions. You can talk to me in Urdu and I can translate it to the speaker. No worries. You can unmute yourself.
No questions?
I think so. We don't have any questions.
All right. Well, with my final comments, I just want to point us back to solar and ownership, the smallest pilot that proves the concept. One high pain process, one value stream map, a Kaizen event, whatever you think would work best. And physician buy-in, where they're not employees. You can co-design with them, show them patient value data, start with their pain points. People help support what they help to create. And just think incentives. WIFMs is also what we call them. What's in it for me's. Other than that, I hope you enjoyed my presentation and it was valuable.
Anyone has any feedback, you can unmute yourself and let the speaker know. If you are not comfortable with speaking English, you can let me know in Urdu. I can translate it. No issues. Anyone?
All right, Sammy. Well, it looks like we don't have any questions, so I hope that's a good sign and you liked my presentation. I did see a lot of thumbs up and heart symbols, so that's, I think, a good sign. I would love to connect with you on LinkedIn as well. So the QR code you see here is my LinkedIn. Connect with me. Let's keep the discussion going. Also, I am open to other speaking events if you'd like me to speak on any project management topic. My primary doctoral research, however, is emotional intelligence in complex project environments. I actually spoke at the University of Texas at Dallas a couple of months ago on the topic. I have that posted on my LinkedIn. If you're interested, you can take a look at that. But with that, I also have a gift for you. I will be posting this presentation on my LinkedIn, and included will be all of my references, including links to each source. So if you're interested in doing a deeper dive in the research that I did and what a particular study may have found and how they use the tools, etc., there's a lot of really, really good information out here. So that is my gift to you.
Okay, so you can find the LinkedIn profile on screen. Even then, I'll send the speaker's LinkedIn profile in the group. As we have reached a successful conclusion for this session, now let me conclude. Sure. The whole presentation was clear, crystal clear. It did not miss anything out. It was made totally interactive. I really appreciate your time. Now, the time for this session has elapsed. Let's give our speaker one last applause. Everyone, please.
Thank you so much, everyone. Thank you. Thank you so much.
So now, it's my statement. Thank you, Shawna, for joining us. It was truly heartwarming to see you here, join us, and present the whole presentation. Thank you for the whole audience. Gratitude to all of you for joining us. You were such a great audience. I really appreciate it. Thank you. Bye bye.
Thank you. Have a good one, everyone.